Study Unit 3.4 Ergogenic Aids. Ergogenic aids is anything that an athlete will use to improve performance. These aids can be illegal or legal. When we hear ergogenic aids, we often think of Lance Armstrong. He used EPO, an illegal aid, to improve his cycling performance. The outcomes of this study section is to define ergogenic aids and describe possible mechanisms of the operation of these aids, to give examples of substances and procedures which may have ergogenic advantages, to discuss the operation of anabolic steroids as well as the effectiveness and the risk involved for both men and women. To describe the following ergogenic aids: beta-2-adrenergic agonist, human growth hormone, DHEA, androstenediol, amino acid supplements, carbohydrate supplements, protein supplements, amphetamines, caffeine, buffer solutions, red blood cell reinfusion, EPO, hyperoxia, creatine supplements, medium-chain triacylglycerol, pyruvate. Ergogenic aids refer to the application of nutritional, physical, mechanical, psychological, or pharmacological procedures to improve physical work capacity or sport performance. Examples of nutritional components include carbohydrates and amino acid supplements. Examples of physical techniques include warm-up. Mechanical include massaging, and pharmacological include red blood cell reinfusion and hyperoxia. Research shows that the following substances leads to ergogenic advantages. Examples: alcohol, mixture rich in oxygen, caffeine, amphetamines, massaging, music, hypnosis, cocaine, anabolic steroids, and warm-up. Can you think of the mechanisms of these ergogenic aids to improve performance? Ergogenic aids can be divided through the mechanism they work from. Pharmacological ergogenic aids include amphetamines, beta blockers, caffeine, and diuretics. Hormonal include anabolic steroids and human growth hormone. Physiological include bicarbonate, blood doping, EPO, hyperoxia, and phosphate loading. Nutritional include amino acids, creatine, and L-carnitine. There is increasing difficulty to ensure justifiable sport practices. The improvements in technological and unethical techniques to boost sport performance have grown dramatically. This growth made it necessary to find better procedures to identify these substances. Some history regarding ergogenic substances. Romans and Greeks believed that raw meat improves animal competitiveness. In 1908, marathon athletes believed that alcohol improves performance. In the 1950s to the 1980s, the use of forbidden substances to improve performance reached a maximum. In the 1970s, personal dietitians recommended high carbohydrate meals to minimize muscle exhaustion. In the 2004 Athens Olympic Games, there was a good impact against forbidden substances. There is plenty of procedures to test for illegal substances, but the urine test is still the primary method to test forbidden substances. What is fact? What is fiction? Which ergogenic aids provide advantages and which don't? How do we determine this? We determine this by means of the placebo effect. The placebo effect is the acquired effect because of an experimental person's expectation after application of an inactive substance, the placebo. In this experiment, we identify how the placebo effect was used to improve weightlifting performance. In this case, the placebo effect had a greater effect than actual training. It is very psychological. Naturally, there is even more ergogenic aids being developed that we will not be discussing in this study unit. A good example is gene doping. Changes in genes can lead to specific improvements irrespective of the specific sport, aerobic or anaerobic. Gene doping is extremely dangerous. What is the mechanisms that make ergogenic aids functional? Ergogenic aids. Some of them react as a stimulant for the central or peripheral nervous system, for example, caffeine, choline, amphetamines, and alcohol. Some of them increase storage and/or availability of a limiting substrate, for example, carbohydrates, creatine, carnitine, and chrome. Some of them act as a supplementary source of fuel, for example, glucose and medium-chain triglycerol. Some of them reduces or neutralize performance-inhibiting metabolic byproducts, for example, sodium bicarbonate. Some of them facilitate recovery, for example, carbohydrates or water. Anabolic steroids, human growth hormone, and protein and carbohydrate supplements promotes reactivity on performance exercises. Pharmacological aids. There are 9 categories that are banned by the World Anti-Doping Agency, namely anabolic androgen steroids, hormones and related substances, beta-2 agonists, hormone antagonists and regulators, diuretics and other masking agents, stimulants, drugs, cannabinoids, glucocorticosteroids. Why do you think each of these categories is banned? Let's start with the most common banned aid, anabolic steroids. Anabolic steroids was developed in the 1950s for medical objectives. For example, people that had a shortage in natural androgens, muscular dystrophy diseases, treatment of osteoporosis, treatment of breast cancer. It prevents a decline of lean body mass as well as increased body fat in elderly men, HIV patients, and kidney failure patients. 4 million people use androgens at the moment. 90% of all male bodybuilders make use of androgens and 80% of all female bodybuilders. What is the structure and function of anabolic steroids? Anabolic steroids are almost identical to male sex hormones, like testosterone. Testosterone contributes to male secondary sex characteristics and are mainly produced by the testes. The adrenal gland also produces testosterone. More about this in study section 5. The synthetic manipulation of the steroid's chemical structure increases muscle growth and decreases the hormone's androgenic or masculinization effect. You'll remember this from homeostasis, study unit 2. What is the homeostatic control that is applied when people are misusing anabolic steroids? The stimulus is the increased testosterone from the injection. The receptor and the integration center is both the hypothalamus and the anterior pituitary gland. The integration center tells the effector, the testis, to reduce the testosterone production. thus destabilizing the testosterone concentration in the blood. This influences your natural production of testosterone. The proposed ergogenic advantages of anabolic steroids include an increase in fat-free mass and power, recovery of exhaustive exercises. Anabolic steroids aren't just abused by bodybuilders. The following sports are also known to misuse anabolic steroids: road cycling, tennis players, track and field athletes, American football players, rowers, swimmers, rugby players, other highly competitive sports. Competitive athletes obtain steroids from the black market. These individuals takes in anabolic steroids in excess because there's no clinical monitoring of the dosages. Risk using anabolic steroids in people that are still growing include reaching manhood quicker and also the premature cessation of bone growth. These individuals will have a short body length. It is extremely dangerous for growing individuals to use anabolic steroids. At the end of the day, it is about the choice of using anabolic steroids for performance enhancing against the life-threatening risk that it may cause. Naturally, dosage is an important factor. This experiment illustrates the effects of testosterone misuse on different factors of the individual. Fat-free mass is higher with the use of anabolic steroids. The triceps and quadriceps is larger with the use of anabolic steroids. Bench press and squat strength is also higher. The risk and adverse effects of the use of testosterone include impaired normal testosterone endocrine function, reduced serum testosterone in male athletes, infertility, reduced sperm contractions, reduced testicular volume, increased estradiol concentration, female hormone. This leads to gynecomastia. This is not muscle, but this is breast. Risk and adverse effects of anabolic steroids during exercise. It may damage connective tissue that can give rise to reduced tendon strength and elasticity. Chronic stimulation of the prostate gland. Injury and functional changes in cardiovascular function and myocardial cell cultures. Reduced diastolic relaxation and exacerbation of normal cardiac hypertrophy with resistance exercise. Potential negative effects on the thyroid gland and hormone functions. Increased platelet aggregation can lead to increased risk for stroke and myocardial infarction. People don't die from the previously mentioned risk, but rather from liver and kidney tumors, lymphsarcomas, and heart damage. Pileosis hepatitis is a common occurrence in anabolic steroid abusers. The liver metabolizes androgens. The prolonged use of steroids causes damage to the liver. This forms blood-filled lesions on the liver, which eventually can lead to death. There are multiple woman-specific risks due to anabolic steroids, namely masculinization, changes in menstrual function, excessive body hair and facial hair, which is called hirsutism, deepening of the voice, reduced breast size, and sterility. Summarized, we can divide the adverse effects of anabolic steroids as follows. Men have increased testicular atrophy and gynecomastia, as well as reduced sperm count and testosterone levels. Women's voice deepens, they develop face hair, menstrual irregularities, and enlargement of the clitoris, as well as decreased breast size. Men and women have the combined following adverse effects and medical risk. detrimental changes in lipid profiles, including elevated LDL cholesterol, neoplastic liver disease, aggression, hyperactivity, irritability, withdrawal and depression when cessating steroid use, acne, good cholesterol, high-density lipoprotein decreases. Anabolic steroid can also possibly lead to hypertension, damage to connective tissue, myocardial damage, myocardial infarction, delayed thyroid function, and changes in myocardial structure. Clenbuterol and other beta-2 adrenergic agonists. Clenbuterol is used as a substitute for anabolic steroids. Bodybuilders use this before their competitions. Benefits of clenbuterol include tissue growth and fat loss benefit. It also does not cause the side effects of anabolic steroids. For example, there is no adrenergic effect on women. How does clenbuterol work? The drug increases the reactivity of epinephrine and norepinephrine. Do you remember the fight and flight response? Clenbuterol is prescribed to treat bronchial asthma in Europe. Research has shown that there are advantages to using clenbuterol as mentioned here. However, there are also negative effects of the use of clenbuterol, which is stated in this slide. Clenbuterol is a banned ergogenic aid. You can read more about beta-2 adrenergic agonists in your textbook. Human growth hormone, a hormone that is recently being widely used by athletes. A synonym for growth hormone is somatotropin. This natural hormone has two main functions: tissue growth and performance improvement. Growth hormone is produced by the anterior pituitary gland in the brain, or adenohypophysis. Growth hormone's effects aren't primarily mediated by growth hormone, but rather through IGF, insulin-like growth factor. The anterior pituitary gland produces growth hormone, which is transported to the liver through the blood. The liver is stimulated to secrete IGF-1. Why insulin? Insulin not only causes blood glucose to decrease, but also stimulates protein synthesis. Growth hormone is an anabolic, meaning it causes protein synthesis, and lipolytic agent, meaning it leads to fat loss. Growth hormone stimulates bone and cartilage growth that is used for the treatment of certain sport injuries. Growth hormone promotes the breakdown of fatty acids but reduces the breakdown of glucose and amino acids. Thus, it will improve muscle strength and endurance, and this will increase fat-free mass. Let's weigh the pros and cons of exogenic growth hormone. The positive effects we've already discussed. The negative effects include gigantism. This develops if the hormone is used by individuals who are still growing. Acromegalia. If the individual already reached skeletal maturity, structures like one's jaws, hands, ears, and nose never stops growing, and growth hormone stimulates this. Cardiomyopathy. As the heart is also a muscle, it grows along with the other muscles and reduces the space of the heart chambers. Glucose intolerance leads to diabetes. Hypertension is also a side effect. As you can see here, a person's concentration of growth hormone declines as one gets older. Where do one get exogenic growth hormone? Of course, on the black market. But where does the black market get it from? From cadavers. The risk then arises that one can get a very bad disease called Creutzfeldt-Jakob's disease. This is really a terrible disease. Why is ergogenic agent commonly used by athletes? It stimulates amino acid uptake and protein synthesis, while it helps to break down fat and conserve glycogen. Growth hormone occurs naturally in the body and thus makes early detection thereof difficult. Why is it illegal? Children that use growth hormone will develop gigantism. Adults will develop acromegaly. Insulin resistance can lead to diabetes. Water retention can lead to high blood pressure. Carpal tunnel syndrome is common as a tissue growing struggles to grow through the narrow space of the carpal. DHEA. DHEA is a weak steroid hormone that is produced by the body naturally. It is synthesized from cholesterol by means of the adrenal cortex. The chemical structure of DHEA is similar to testosterone and estrogen. DHEA is a natural hormone, not an anabolic steroid, and therefore falls under diet supplementation. Here one can see that DHEA and androstenediol is a predecessor of anabolic steroids. Functions and effects of DHEA: increases testosterone production, protects the body from various diseases like cancer and diabetes, preserve youth, promotes sex life, reduce joint pain and fatigue, facilitate lean body mass and weight loss, improve mood, and extend years of life. The risk associated with DHEA include increased risk of heart disease for women, risk of breast cancer, possible effects on the stimulation of prostate gland tumors. If cancer is already present in the person, it will increase the growth of the cancer. Here we can see how a person's natural levels of DHEA declines due to aging. This is a possible question that can be asked in tests and exams. If testosterone, growth hormone, and DHEA occurs naturally in the body, what is the harm in ingesting these natural compounds? Androstenedione. Controversy surrounds androstenedione as a harmful nutritional supplement or a harmful drug. Androstenedione occurs naturally in meat and some plants. Similar to DHEA, it is a precursor to testosterone. Androstenedione stimulates the production of endogenic testosterone. This enables the body to master intense exercise, builds muscle mass, and helps with the rapid recovery of damaged or injured tissue. However, some research has shown contradictory evidence, such as no beneficial effects on muscle mass or muscle performance. Here we can see how androstenedione affects testosterone and estrogen levels. Amino acid supplementation as ergogenic agent. Please remember the 8 essential amino acids. Amino acid supplementation is legal. You can buy protein shakes at Dischem. Protein synthesis is facilitated by changing the hormonal environment. Amino acid supplementations above the recommended protein intake does not provide ergogenic benefits. There is no benefit in hormonal profile, body composition, muscle mass, or exercise performance when ingesting amino acids above the recommended protein intake. Ingesting too much amino acids can lead to amino acid imbalances. Note: resistance exercise stimulates protein synthesis and protein degradation in trained muscle fibers. Muscle hypertrophy will only occur when there is a net increase in protein synthesis. The period after resistance exercise is extremely important because it is when protein synthesis occurs. If your diet includes amino acid supplementation, it will increase energy availability and anabolic hormones that theoretically will increase the rate of anabolism. How does this occur? Remember this from study unit 3.1? You can see here that the timing of when amino acid supplementation is taken in is extremely important. The following table summarizes the various techniques to promote protein synthesis. Firstly, a carbohydrate protein creatine supplementation during recovery will lead to increased protein synthesis. Secondly, post-exercise glucose will promote protein balance after resistant exercise, mediated by increased insulin release. Thirdly, even dietary lipids can also promote a hormonal environment, as anabolic hormones like testosterone are produced from lipids like cholesterol. Amphetamines, recreational drug or ergogenic agent. Amphetamines are a class of recreational drugs, where the most common drug is known as speed. Amphetamines or pep stimulate the central nervous system. Examples of amphetamines include ephedrine and pseudoephedrine. What do amphetamines do? Amphetamines are very similar to epinephrine and norepinephrine because it stimulates the fight and flight response that increases blood pressure, heart rate, and cardiac output. It also increases breathing rate, metabolism, and blood glucose. Increased alertness and reduced fatigues are also a function of amphetamines. Amphetamines is extremely dangerous because it can lead to heart attacks. There are many risks associated with amphetamines. As many recreational drugs, it is addictive. It causes nervous system symptoms such as headaches, tremors, dizziness, and confusion. It can even lead to death due to cardiac arrhythmias, abnormal heartbeats. Athletes take amphetamines to get a boost from competition, but it has a risk to make the athlete nervous and irritated. It has a lot of psychological effects, not so much physical effects, but psychological. Amphetamines are banned by international sports. Caffeine. Caffeine is really a good ergogenic agent and may be the only exceptions to stimulant as ergogenic agent. There are various types of sources of caffeine. Medications such as migraine medication include caffeine. Foods like coffees and soda, as well as energy products such as Red Bull. There is also caffeine in coffee beans, tea, chocolate, and cacao. The proposed benefits of caffeine include increased mental alertness, concentration, reaction time, and energy levels, reduced fatigue, and increased mobilization and use of free fatty acids. There are many more ergogenic effects of caffeine, such as improved endurance and short explosive performance, improved team sport performance, improved catecholamine release, and improved use of fats. This experiment states that times improved by taking in caffeine for the 500, 1000, and 1500 meter swim events. The period to fatigue improved in cyclists with the ingestion of caffeine. How does caffeine improve performance? It facilitates the use of fat as an energy source instead of carbohydrates and leads to the conservation of muscle glycogen. It also causes motor neuronal firing to recruit more motor units. Here we can see fat is used more as an energy source with the intake of caffeine. Also remember the term R, which stands for respiratory coefficient. It is an indicator of carbohydrate metabolism. You can see how it decreases with exercise duration and is also lower with the ingestion of caffeine. Caffeine also affects the nervous system that contributes to ergogenic benefits. It reduces the threshold for motor unit recruitment. It changes the excitation-contraction coupling. It facilitates nervous transport and increases ion transport in the muscles. Moderate caffeine intake definitely have health and ergogenic benefits. How does caffeine affect muscles? It improves the exercise capacity of muscles by stimulating motor nerves electronically. Of course, there are risks to ingesting too much caffeine. For example, nervousness, restlessness, involuntary muscle contraction, insomnia, shivering, increased heart rate and blood pressure, premature left ventricular contractions. My heart gave an extra beat. Tremors, dehydration due to increased urination, disturb normal sleep patterns leading to fatigue. Caffeine is a diuretic, which leads to increased urine production and excretion. Caffeine can lead to weight loss and serve as a masking agent during testing. Here is a summary of the negative effects of ingesting too much caffeine. On the figure, one can see the caffeine intake of coffee and tea. Energy drinks do have a lot more caffeine when compared to tea and coffee. Ginseng and ephedrine. Ginseng and ephedrine is known for reducing stress, providing new strength, burning calories, and optimizing cognitive and physical performance. Ginseng is self-study. Ephedrine. Ephedrine has medical purposes like the treatment of asthma, symptoms of cold, hypertension, low blood pressure, and depression. Ephedrine was removed from the banned substance list due to insufficient evidence of ergogenic benefits. Effects of ephedrine include increased heart rate, cardiac output, blood pressure, and bronchodilation. These effects can lead to hypertension, insomnia, hypothermia, and cardiac arrhythmias. Why do people use ephedrine? It speeds up metabolism, improves exercise performance. Important: the prolonged effects of ephedrine is not yet confirmed by research. Buffering solutions. pH changes during exercise quite dramatically and is one physiological variable that are not always controlled as well as other physiological variables. Maximal exercise of 30 to 120 seconds causes energy to be produced anaerobically. This leads to lactate accumulation and pH declines. The increase in acidity inhibits the transfer of energy and affects the contractile dynamics in active muscle fibers. Exercise performance is decreased. One can buffer lactate by means of bicarbonate, which lowers intracellular acidosis. This is especially important during anaerobic exercise. Here you can see how bicarbonate buffers blood lactate levels and leads to improved peak power. Anticortisol compounds. Remember, cortisol is the stress hormone. Anticortisol compounds work against cortisol and thus can provide ergogenic benefits. Glutamine and phosphatidylserine is examples of anticortisol compounds and is self-study. Beta-hydroxy beta-methylbutyrate. It reduces protein loss by inhibiting protein catabolism. You can look in your textbook for further information. Non-pharmacological agents. These include red blood cell infusion, hormonal blood promotion by means of EPO, hyperoxia, carbo loading, chrome, creatine, lipid supplementation, and pyruvate. Let's first talk about red blood cell infusion. How does it work? Blood doping. Autological transfusion is where 1 to 4 units, 1 unit meaning 450 milliliters of blood, is withdrawn from the athlete and stored for subsequent infusion. The blood must be stored under special conditions. Hematological transfusion is where the stored blood is transfused over before the event. The infusion increases red blood cell and hemoglobin levels by 8 to 20%. On this figure, one can see the hematological changes during red blood cell infusion. After autological transfusion, the red blood cell concentration is low. A time period should be given for the red blood cell concentration to return to the control value. It takes about 6 to 8 weeks. After this hematological transfusion occurs and red blood cell concentration rises dramatically, the body tries to return the red blood cell concentration to the control value by producing fewer red blood cells. Blood doping increases the concentration of red blood cells and with this, blood volume. The increased concentration of red blood cells causes more oxygen to be delivered to the tissues. Remember, increasing the red blood cell concentration also increases hemoglobin concentration. All of the previously mentioned leads to significant endurance performance by increasing the oxygen carrying capacity of the blood. This increase VO2 max, time to exhaustion, and measurable performance. The risk of blood doping include increased blood viscosity, the flowability of the blood, reduced cardiac output precisely because of this increased blood viscosity. This also reduces blood flow, reduced peripheral oxygen supply. Also, if the blood types of the donor and the recipient are not compatible, it can lead to death. Of blood transfusion include HIV/AIDS and hepatitis B and C infection. The blood thickening may also cause a stroke. EPO, erythropoietin, hormonal blood promotion. EPO was used by Lance Armstrong to win the Tour de France. EPO is also used widely by many current cyclists. Similar to blood doping, the proposed ergogenic benefits of EPO include an increased oxygen carrying capacity of the blood. EPO stimulates red blood cell production. EPO is secreted by the kidneys. The hormone stimulates red blood cell production in the bone marrow. Here is also a natural homeostatic control system involved in maintaining normal oxygen levels. The stimulus is reduced oxygen levels. These reduced oxygen levels are observed by the kidney, the receptor. The kidney acts as integration center and effector. The kidney secretes EPO, which increases red blood cell production in the bone marrow. Due to the increased red blood cell production, it will increase oxygen levels. This is obviously negative feedback. EPO works in a similar method as blood doping. Increase red blood cells, increase oxygen delivery to the tissue. The EPO throw, new Olympic discipline. The point is there are more red blood cells. Due to the increased red blood cell concentration, resistance to the heart increases, as well as VO2 max and aerobic endurance. Eventually, it leads to improved performance in long-distance events. Side effects of EPO is extremely dangerous because blood viscosity increases, and this can lead to myocardial infarctions and stroke, similar to blood doping. Hyperoxia, 100% oxygen inhalation. What happens with the use of hyperoxia? The increased oxygen capacity of the blood increases, and this leads to the ability to compete at higher intensities. It delays fatigue and leads to faster recovery between workouts. Improved performance and reduced lactate concentration is confirmed effects of hyperoxia. In this experiment, we can see the influence of hyperoxia on anaerobic exercise performance. Revolutions per minute was higher with the use of hyperoxia in cyclists. VO2 max improved with the use of hyperoxia as well. As far are there no risk associated with hyperoxia, although 100% oxygen is flammable. We will learn more about hyperoxia in Exercise Physiology 2, Study Unit 4.1. Changes in carbohydrate intake. Carbo loading is self-study. We'll just quickly look at an experiment on carbo loading. This figure illustrates how exercise duration decreases and carbohydrate intake increases prior to the commencement of race day to optimize carbo loading. I hope you remember this from Study Unit 3.1 and Study Unit 3.3 as well. Chrome is cell study. Creatine. Creatine is known to build muscle mass, enhance sports performance, and prevents muscle fatigue. Creatine is a product naturally produced by the body. Creatine is not a hormone. You can get creatine as a supplement in the form of powder, gel, liquid, tablets, chewing gum, and sweets. Certain foods are also rich in proteins, such as meat, fish, and milk. Creatine plays an important role in metabolism. We will have a detailed look at creatine in Study Unit 4. Creatine is a reservoir for ATP. If ATP is used up, creatine phosphate will resynthesize ATP. Thus, creatine plays a major role in explosive type action that lasts a few seconds. An increase in the limited intramuscular creatine will lead to accelerated ATP turnover to maintain power during short duration muscle exertion. It will reduce creatine depletion as well as reduce the reliance on aerobic glycolysis, leading to reduced lactate formation. It will facilitate muscle relaxation due to repeated intense short exertion exercise through faster ATP and creatine phosphate resynthesis. Benefits of creatine in terms of performance include performance enhancements in muscle strength and explosive power, muscular endurance during short duration activities, and provide also a bigger muscle overload to improve exercise efficiency. In this experiment, we can see how creatine leads to an improvement in the amount of work that can be done with cycling. Note also that creatine works better when you take it in after exercise. This is the mechanism how creatine leads to an improvement in short-term muscle performance. In this experiment, we see how body composition changes with the increase of creatine. Body weight, fat-free mass, and even fat increased with the ingestion of creatine. Fat-free mass increased more than fat, however. Strength in the squat and bench press increased with creatine supplementation. All four fiber types, slow and fast, increased in cross-sectional area with creatine supplementation. The adverse effects of creatine include interference with the body's own production of creatine, muscle cramps during exercising heat, torn and strained muscles due to increase in muscle strength and not increase in tendon elasticity, kidney damage, liver damage, elevated blood pressure, heart disease, and even stroke. There are certain precautions for the use of creatine supplements. You can only use it for short periods. And if you are younger than 18 years, you should consult a physician before ingesting creatine. Creatine is not on the International Olympic Committee's list of banned substances. This brain diagram sums up the use of creatine and its use for performance. This diagram should help you with your studying of this material. Lipid supplementation is self-study, as well as pyruvate. The end.